This is Dr. Kermott, and here is a little video about depression. Depression is one of my main specialties and something that I feel like is very important to me. If you want to learn about depression, you can of course pull up the Diagnostic and Statistical Manual of Mental Disorders, which will give you these symptoms of depression like difficulty sleeping or sleeping too much, changes in appetite, changes in sexual function, feelings of sadness, changes in body weight, feeling worthless or suicidal thoughts. And while I think it's important for us to talk about these symptoms of depression, what I really focus on with people is the subjective experience of depression. Because even though someone can tell you what the symptoms are, no one but yourself can tell you what it feels like to have depression. Even more so, no one can tell you what your depression really feels like. And for me as a therapist, that's what I'm most interested in. When I work with people, I want to spend time getting in their shoes, trying to feel what it's like for them to wake up in the morning and have some of those difficult thoughts about not being able to get through the day, not feeling like they want to get up out of bed. I want to know what it feels like to not always get pleasure out of life, to not be able to remember the last time something was really exciting or purposeful for you. Essentially, what I'm saying is that when you're working with a therapist, it's important for you and the therapist to, like I said, not only talk about the symptoms of depression, but to talk about what it feels like for you in particular. I feel like the best way I can be helpful as a therapist is to first understand, get a sense for myself, what your experience of depression is like, because it's only from there that we can then chart a course to feeling better. Depression is something that is unique to the person, and you can't just pull out a manual to decide how to get help for depression. I hope this little video has been helpful for you in thinking about finding a therapist and thinking about treatment for depression. And I hope it's been helpful in sort of explaining how I think about depression and how I think about helping my clients who come in with depression.